Hello, I wanted to show you guys about the Carpu-Jet that I want you to practice using, and I know a lot of you have never used these before. This is something that is really old school, actually. They've been in the hospital a long time, but nurses have gotten out of the practice of using them for the convenience of disposable syringes. But that's a huge waste. So the hospital's Sharp in particular is insisting that nurses use these. You may not see it used every time, but that is the goal because it's a lot less waste. So this is the Carpu-Jet. These are the medications this is what the medications look like that go in the Carpu-Jet. Some meds that you'll see in these would be morphine, hydromorphone, Ativan, and Valium, for example, a few of them. So you're going to get them out of the Pyxis like this. You're going to verify your dosage, and we're going to say this is morphine 1 milligram per milliliter. So this is the Carpu-Jet when it's open. See how the blue is, okay, this is when it's closed. This is when it's open. That's how you need it to be when you put it in. So you put the syringe in there. It clicks in at the top. You turn the blue to lock it in. And then there's a little threaded gray thing in here that you need to screw this white plunger into to get it threaded. There, just a few, maybe 5-6 turns. And so now the plunger is threaded. You're going to take off the cap. So you can't see this, but it's about half fluid and half air. So you have to push out the air, of course, before you're going to give the medication. So you need to very slowly push it so you can see the fluid line rising, and there it is. It's really hard to see, but you got to go really slow, that way you don't waste anything. So we're going to push all that air out, and the plunger should end up right about where my thumb is, because that's the 1 milliliter mark. Yep. And so now we have 1 milliliter. So if it's morphine 1 milliliter per milligram, this is 1 milligram of morphine. If that's what we're giving, great. Then we go in there, we clean the hub on the patient's IV, plug this in. It's lure locked just like a syringe. Plug it in, push slowly, then flush if you need to. Unplug it, and I'll show you how to dispose of this in a minute. But what if it's not a milligram? What if the order is not a milligram? It might be half a milligram or 0.8 or 0.4 or anything. So that's where you need to waste. So there's little lines on this cartridge. The bigger line is 0.5, obviously. So then there's 9, 8, 7, 6, 5, etc. So what we're going to have to do is waste this. And because if it is morphine, it is a narcotic, so we need a second witness. So we're going to get our witness, and we're going to waste this into the proper medication receptacle, not the sink. And we're going to push this up. We don't want to waste into the sink because the fish don't need morphine, nor do we need it in our drinking water. So let's say, I'm just squirting this in the air, but we would put it in the proper receptacle, and we're going to give 0.6. Boom. Right there. So there we have 0.6. So I'm going to clean the hub 15 seconds with alcohol, insert this into the patient's IV, push it over 2 minutes, then do the flush over 2 minutes, and then unscrew it. Now we need to remove this and get rid of it. So first thing is unlock the blue, unscrew the white, and then this just pops out. The plunger is still intact in there. We didn't pull that out. If you had not unscrewed the white and just pulled it out, you'd pull out the plunger with it. Then this goes in the medication waste bin. So each hospital will have specific colors for medication waste. That's where you put your vials and tubing and that kind of stuff. So that goes in the medication bin. This gets cleaned and goes back in your pocket, or the nurse's pocket. I would clean it with alcohol at a minimum each time after use. You can also just wash it when you wash your hands in the sink, or you could use cavi wipes on it. But you do want to definitely clean it before taking it to the next patient's room. So that is it. Practice, teach each other, and get used to using these in the clinical site. Thanks.